Hello and welcome. My name is Chris from ChristopherHole.com. Thanks for coming to watch this video where we're going to be talking about lower back pain. We're going to look at a few different elements of it. We're going to look at possibly what it is, some different causes, and some treatment ideas. Now, what it is, a common disorder involving the muscles, nerves, and bones of the back. So it can be very varied. It's a pain that can vary from a dull, constant ache to a sudden, sharp pain. So there are many different types of back pain that it could be, and when we're talking about causes and treating it, we have to take that in consideration as well. So some potential causes, it could be sacroiliac dysfunction, which sacroiliac is where the sacrum, which is this part of the lower back here, meets the ilium, which is this part of the hip here. So it's basically it's that joint there, and there it could get too stiff, and that can create potential lower back pain. It could be facet joint irritation. Now you can't really see them on this picture, but you've got between each vertebrae you've got a little facet joint. So it could be those becoming irritated, and then the pain is obviously then created from that. You've got ligament or muscle strain. You've got many different ligaments, many different muscles in this area. I don't have really time to go through it in this video, but there are a lot there. So they could be strained for whatever reason, through heavy lifting, through repetitive lifting or poor posture. Or then you've got arthritic changes. So this could come with age, where certain vertebrae become arthritic or certain joints become arthritic, and that then starts to create pain in itself. So potential treatments we would look at is keeping it mobile. So mainly focusing on the hips, because the hips can be, I call them like the pressure cooker, and the lower back is like the funnel where the steam comes out. So if there's a lot of pressure in the hips, there's going to be a lot of steam or pain coming out of the lower back. So it's making sure those hips are nice and mobile. If we're talking about massage techniques, it would be making sure there's plenty of blood getting to that area so it's able to stay loose and the muscles are able to stay warm so they can stay supple, so we can keep everything mobile as well. So it's quite a, I don't want to say vague video, because there are a lot of different variables that could be involved, but we're talking from a very general perspective about what the back pain could be. If you're going to see someone, make sure you go and see a few different people, get a few different opinions, build your understanding of what your back pain potentially is, and then sort of deduce from the different opinions you've got to give yourself a better idea of what the pain is. So just a quick summary before I finish. It's a common disorder involving different tissues of the back, so muscles, nerves, bones, ligaments, tendons. The pain can vary from a dull ache to a constant sharp pain. It's caused by different parts of the back, the sacroiliac joint, the facet joints of the vertebrae, ligaments, muscles, or arthritic changes. Potential treatments would be keeping it mobile, so keeping the hips mobile, and then massage techniques to keep blood flow to that area, to keep them supple, to keep them warm, and to keep them flexible enough to be able to keep moving. So many thanks for watching. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.